a patient's come in with a terrible injury.
Now, my love, I'm Dr. Whitelaw. I'm Sarah. I'm one of the emergency doctors here. What's your name?
Michelle.
Michelle, and you're a nursing student?
Yes.
What's happened to you?
I was training one of my horses to tie up.
Okay.
And I used a tie blocker ring, and I reached for it at the wrong time, and it pulled my 3 fingers through the middle ring.
Okay.
And I was stuck while he's pulling me back.
Oh, dear. So you didn't fall down, didn't hit your head, the horse didn't injure you at all, it's just the hand?
Yeah.
Horses are really, really strong. So that amount of force, unfortunately, pushing her fingers against a piece of metal has resulted in quite significant injuries for her hand.
So I don't want to look at it when you have a look.
Okay, sure.
Like a coping mechanism.
Totally understand.
Head in the sand or screech it.
Okay, good. Now, let's see if I can get... Are you able to hold that up?
Yeah.
Are you sure? Otherwise I can get someone in to help me. Okay, my love. We won't do too much pulling.
From the minute I see Michelle's finger, I worry that the tip of that finger is not salvageable.
You're very tough and very brave.
Unfortunately, the tip is just hanging on by a piece of skin.
Can you make a fist? Good. And what about with this one?
No.
You can't make a fist with that one? Okay. Is that sore?
Yeah.
Yeah, sore all the way?
Everything. Yeah.
Okay, my love, no worries. All right, I'm going to pop you back on here. I'll pop this over the top so you can't see it.
Okay.
Okay, yeah. No, you're not at all. You're exceptionally brave, hey? Okay. I am going to see if I can get someone to just give me a hand, position it.
Michelle is really frightened. She's also really worried about how bad the injury is underneath because I don't think she's seen what's gone on to her hand since the injury actually happened many, many hours ago.
Michelle's not only too scared to look at her injury, she reveals she has a phobia of both needles and the sight of blood. Tricky for her chosen career path.
Trying to build up my tolerance because I'm a nursing student. I plan on just being the school nurse or something, not so at the high end of what these amazing people do.
Can I ask you to give me a hand? I just need to take a photo of that.
Dr. Sarah needs another pair of hands to treat Michelle so she can continue to avoid looking at her injury.
Don't touch it without pain, really.
Yeah. So the photos just go into your medical record.
What a good idea.
Yeah, it is. It's cool. I can show our plastics team and they can start organising stuff.
I'm in a bit of trouble, aren't I?
Look, it will have to go to the operating theatre. I think they'll what we call formalise and sort out that second, the ring finger. That's the one that just needs sorting out.
Needs a ring on it.
Well, they can put a ring on it definitely on the end and it will look beautiful.
What I can't tell when I look at Michelle's finger is where she will need to have that finger amputated. I'm hopeful that it might involve just the tip, but my concern is that she may actually lose even more of that finger.
On the rooftop, air ambulance is bringing in a man involved in an horrific accident.
Royal Melbourne received. See you soon. So it's on time.
As the team prepares the trauma bay, Nurse Jenna Allman is expecting the worst based on what she's hearing.
So we know it's a 54-year-old gentleman and he's rolled his car multiple times. We always have strict roles that we play when a trauma patient comes in. So mine today is to support the anaesthetist or the airway doctor to manage the patient's airway in case he needs to be intubated and put on a ventilator. Who's team leading?
Leading the team is emergency doctor Ali Majazadeh.
I was born and raised in Iran. I grew up in a family of doctors.
It's a trauma call, right?
Yes.
So the trauma team is here.
Of course, I'm from the region. There are lots of wars every year. That probably motivated me to join medicine and especially emergency medicine.
So we have the med pack ready in case we have to give any blood. I'm gonna look after you with the team here, okay? We're just gonna move you across to our bed and then we go ahead with that, okay?
Okay. I'm 100% deaf on my left side.
Okay. So we're gonna use the right ear then.
We're gonna have to roll you to get you across, mate.
Yeah.
I know it's gonna hurt, so I'll get you some medicine. All right, on 3, 1, 2, 3. Well done.
54 years old. He had a seizure while he was driving around 100K. and then he just deviated and rolled a couple of times. His daughter was also in the car as a passenger, but she's fine. She was able to get out of the car.
I think John is really lucky to survive this accident. Having a seizure behind the wheel is really concerning because there is no protective mechanism. Patient can't control, can't protect the head. But more than that, because of the seizure activity, because of all those movements that we may have with the seizure, they may actually press on the pedal even harder. So they may go faster than what they were driving before the seizure, and that's really concerning.
Do you know where you are at the moment, sir?
Royal Melbourne.
Perfect, good job.
John is a former war cameraman who's had many close calls. But today is different because his daughter Lilia was involved.
Yeah, it was very scary. He was completely fine and I was just talking to him like normal until I look at him and suddenly his eyes are rolled back into his head and he's like choking, like he swerved off the road into farmland through a fence and then finally just stops and I just get out of the car as quickly as I can, screaming for help, like arms in the air, going like, help me, help us, my dad's in there, I don't know if he's dead or not.
Hey, sir, my name's Jenna, I'm one of the nurses. I'm gonna look after you. How are you feeling? You got that pain in your back?
Yeah, it's pretty bad.
Yeah, I bet.
Yeah.
John's shocked, he's trembling. So I think at this point, John needs reassurance that everything is okay. The car might be a bit wrecked, but that's okay. We can get a new car, but the fact that he's alive, he's talking to us, I think that's the message that we need to relay to him.
So can we do a chest X-ray and pelvis for now?
Rolling his car during a seizure could have left John paralysed.
Looks like that John has serious injuries and there's a chance that he broke his back.
At the Royal Melbourne Emergency Department, horse trainer Michelle got her hand caught in a buckle ring while working her horse. She's nearly lost the top of her finger and badly damaged 2 others.
I've got flaps of skin, like something flapping there, and I feel very open and exposed and burning. Not so much throbbing, just excruciating like branding iron.
Michelle struggled to free her fingers with her horse pulling away from her.
My partner jumped between me and the horse and put enough tension on the rope for a second to get me free, which was amazing. So, if he didn't do that, I would be in a worse situation. It was my fault, and I had my hand in the wrong place at the wrong time.
Michelle, who's studying to be a nurse, can't look at her injury because of her blood phobia.
It's really important that whenever somebody has a hand injury and we're worried that the bones underneath might be broken, that we get an X-ray because it really does significantly change the type of operation that she might need to have.
So we're looking at Michelle's X-rays, and what is really good is that little finger, which was very sore when we pressed, doesn't appear to have any broken bones in it. We knew already that ring finger had the top just pulled off it. But the good thing is the other fingers are fine. Yeah, so that's good news.
Dr. Sarah starts organising for Michelle to go to theatre, where plastic surgeons will try and save the tip of her ring finger.
I've got a D-tipping injury that I think is going to need to be formalised in theatre. She's also very tender in her little finger and she's got an injury to her 3rd finger, but it's the ring finger that she has pulled the tip off. Okay, the plastics team are going to take you to the operating theatre. It might not be tonight, so they're happy for you to eat and drink, which is good. So we'll bring you in to hospital overnight and then they'll hopefully get you to the operating theatre early-ish tomorrow morning.
But in the meantime, Dr. Sarah wants to numb her hand and clean it out. But Michelle is also afraid of needles.
I'm not very brave. I couldn't watch a scary movie or a horror movie or anything like that.
What we want to do is give her the best pain relief possible, and we know with Michelle that's probably going to be a local anaesthetic. Unfortunately, that involves needles into areas of Michelle's hand, and that's painful.
If she's going to carry out the procedure, Dr. Sarah will have to gain Michelle's trust.
So it's a needle into the base of the finger. So there's a nerve that goes up this side and a nerve that goes up that side. And if we put a bit of anaesthetic in here and here, it makes the whole finger numb. So it is a needle in here. It hurts, but only for a few seconds.
So this is a really tough situation. If we don't wash out that wound very quickly and very, very well, there are cases where quite small injuries in the hand have resulted in people losing lots greater areas of that hand because the infection has set in.
Pelvic X-ray looks fine as well, so let's go for a CT.
Across the corridor, former war cameraman John is lucky to be alive after a serious car accident.
I basically had a seizure and blacked out while I was driving. And the car went off the road and rolled a couple of times, and my daughter, who's 16, she got out, and then these two guys helped her get me out, and they just put me on the ground, and I was, next thing I knew, I woke up and I was in the back of an ambulance going to the helicopter.
Dr. Ali is concerned John is in a lot of pain and may have serious injuries to his spine.
Okay, let's go.
He needs to be scanned immediately.
How's your pain, mate?
Oh, it's still pretty high. I mean, it's agonising, really.
We need to have that CT scan urgently to find out what are the damages and what we're dealing with.
Oh, man.
You okay?
Yeah, I'm okay.
The former war cameraman's life has been on the line many times, but this accident has left him shaken.
I'm just thinking about it.
Thinking about what's
It's
happening.
usually like that. When you have an accident, it's just a fraction of a second, so you don't actually remember anything.
Yes.
Is that a seizure?
You're a bit shaky in your right hand. Is that normal?
Yeah.
Okay.
Yeah.
How about we have some diazepam ready as well?
If John has a seizure, that fracture can move and result in more damage to the spinal cord.
2 minutes and then we'll come back.
He seems to have a lot of pain.
He's got some thoracic spine fracture.
Can we see that?
That, when it looked like it was in lots of little pieces.
Which level is that? His kidney, so it's L1 or 2. Oh,
That is so nasty.
yeah, that's what we were concerned about, isn't it?
I'm looking at the CT scan. I see what I was hoping to not see. There is a fracture in the spine. The fracture is pretty serious, and it puts some pressure on the spinal cord that might result in paralysis if we don't manage it quick.
For now, we need to make sure that he's not moving. So even moving from the CT bed to our bed is very important now. There's a chance that it might damage the spinal cord. Okay.
Dr. Ali gives the father of 3 the bad news.
Initial result of your scan showed fractures in your spine. It's a little bit concerning because it's at the area that your spinal cord is still there. So we need to make sure that you remain still like this to prevent the risk of damage. And the main concern now is the spine, obviously. Okay. There's a chance that your spinal cord gets damaged, and that may result in problem with your legs, not being able to move them.
It's a fracture of the spine. Yeah, they're going to operate on it soon. Hopefully, I'll still be able to walk.
At the Royal Melbourne Hospital, horse trainer Michelle's nearly taken off the tip of her ring finger while working her horse.
It's a bad day. It's meant to be having a good day.
Michelle's in a lot of pain, but the nursing student is terrified of needles.
A needle into it would just...
Yeah, so it's not into the cart, but it's into here.
It's a very difficult situation for Michelle, and it's a difficult situation for the staff as well. We really need to get her comfortable enough and anaesthetised enough for us to really scrub out those wounds. That's actually what we need to do.
Dr. Sarah asks Senior Emergency Dr. Emma West to help persuade Michelle to have an injection.
What's your name?
Michelle.
Michelle, I'm Emma.
Hi, Emma.
I can put a needle in your finger so you just don't feel it anymore.
A needle into
Not in the end. I would have it. I would hate seeing that on my finger. And I can do this little needle at the base
While paramedics managed to get a cannula into Michelle's arm to give her ketamine, she's still reluctant to have a needle so close to her wounded fingers. Dr. Sarah tops her up with ketamine to help with the pain.
So where's your happy place?
Yeah, where's somewhere that you've been that's
beach.
really, yeah. Which is your favourite beach?
Down south, Silver Sands.
Where's
in
that?
Adelaide, Moana Beach.
Yeah, so just slow, deep
Here
breaths.
comes the ketamine.
And you'll start feeling a bit weird and a bit wheezy, feels like you've had a few beers. Just go with it.
I'm going to do a little scratch nowhere near your sore finger.
What sort of beach was it?
It's quite nice.
Ride the horse. You squeeze my hand as hard as you want. Can you ride the horses on the beach?
Yes,
Wow.
can, but I'm not very happy with horses right now.
No.
It hurts for about 30 seconds, like a really nice wasp sting, and then it all goes nice and numb, and you'll feel so much better. Squeeze my fingers. You're so brave.
Seeing her really overcoming what must be terror in lots of ways is actually quite inspiring. But I think that's part of good patient care, is establishing that trust with your patient that lets you do things that every instinct in their body is saying, oh my gosh, no way.
And can you get oysters near the beach in Adelaide?
Always.
Can you swim? Would you normally go and swim?
No, I'm scared of sharks.
Okay, fair enough.
Me too.
I'm so sorry, guys. I'm trying
You
to
totally-
get it.
I'm just going to leave that sit for a bit. Michelle, I'm touching your finger now. I don't think you can feel it anymore.
I feel a little doo-doo.
What you'll feel now is movement, but you won't feel pain.
That's right.
Yeah.
Yeah, I'm here.
Got your hand here, Michelle.
No.
Just
that's
it's
all
all
right.
good. Yeah, really good. It's a funny feeling, isn't it? It's pressure, and sometimes you can feel cold. Do you want to turn the light off? We may as well turn that light off. Just makes you feel a bit calmer.
Michelle is through her worst nightmare. She now needs an operation to repair the damage.
Yeah, you've done really well. You've been up since early this morning. You've had an injury.
You're amazing. Well done, Michelle.
Michelle is lovely, and I really hope that it doesn't put her off her nursing career. It's funny how many of us were not really comfortable with blood or needles when we first started studying. But the good news is, over many years, that leaves you, and you very much get used to it.
I'm going to bust a move if you're happy. Thank you so much for doing that. I appreciate it. No, that's all right. That's cool. No worries. See ya.
Today we're bringing to you an early 30s gentleman as a major trauma call.
Emergency Dr. Michael Dunn gets a call from paramedics bringing in a seriously injured motorbike rider.
He's had a collision off his road bike. He's been sideswiped by another car and he's high-sided. Heart rate is 110 in a sinus tachycardia. His blood pressure is sitting at 90 on 70. Currently he has no real recollection of the event and is displaying some retrograde amnesia.
Great, see you then, thank you.
Probably get at least 3 or 4 motorcycle accidents a day, but would not be surprised if I would see personally 1 or 2 bad motorcycle accidents a week.
Dr. Michael calls on emergency Dr. Luke Delarue to assist.
Hey, it's Michael here. Are you free to see a trauma coming in?
Yeah, sure. All right, thanks. Cheers, man. Thanks. Yeah, so Michael and I were registrars here at Royal Melbourne together, so we've known each other for quite a while.
Dr. Luke and Dr. Michael are also first-time dads. While they're waiting for their patient, the chat turns to baby change tables.
You know, we were setting up our nursery, and one of my requirements was like, I can't have.
I'm the same,
I can't be on the left
side.
side.
You had the changing table.
Yeah.
I had to approach from the right side.
In med school, you were taught very strictly that you approach the patient from the right-hand side. And it's just a very traditional thing that's been drilled into medical students from day one.
So for Dr. Luke and Dr. Michael, babies' rooms and change tables have to be configured so they can approach their babies from the right-hand side, just like they approach their patients.
And then you can't even change a baby on the wrong side.
I think every new dad who's worked as a doctor will always set up their nursery so they're approaching the baby from the right-hand side, like a patient.
It's just drilled into you for
Isn't it?
day one.
Dr. Luke and Dr. Michael's patient is arriving, and the pair switch back into work mode.
We'll just do a quick brief. So standard approach, Kelly's going to do primary, Michael will quickly do secondary. Obviously, there's potential for chest trauma.
Their patient is a trauma call, which is the highest level of alert, with a life possibly in danger.
So the two main concerns I have for this patient are his very low blood pressure is very concerning for internal bleeding, and the other thing is his conscious state. So he still remains in this semi-conscious state.
Happy to get across and then go story?
Alan was on his way to see his brother when he was thrown from his motorbike trying to avoid a car.
Ready, set, go. That's it, This is Alan. He's been riding his road motorcycle on the Hume Freeway heading southbound. He swerved to veer from a car and he's high-sided off his bike and slid on into the gravel underneath the safety barriers.
High-siding off a motorbike is when the patient comes off the bike sideways but is thrown over the top of the bike. And so even at low speed, it means that there's potential for more serious injury because you've not just fallen off a motorbike, you've essentially been ejected off a motorbike.
On our arrival, we found him to be grey, diaphoretic, and altered conscious state.
So an altered conscious state is when the patient is less awake than we would expect. In the setting of trauma, it indicates that he's potentially bumped his head. If it persists, then he could have a serious brain injury.
Heart rate of 97, blood pressure of 138.
It's been a tough time for the 33-year-old. He and his brother Chris have recently lost their dad.
So when my dad passed away, me and Alan, I don't know if you can become any more closer than we already were, but our bond as brothers is just unbreakable.
And you're on a motorbike, is that right?
So the car cut me off.
A car cut you off.
It's hard to know how Alan's coping with all this. He's quite quiet, and that can be a sign that he's just a very stoic, quiet guy, or he could also be in shock.
And you're in full protective gear, wearing your helmet? Yeah. Did you black out at all?
I don't really very much up until I'm sure I have to leave my already on.
I think what we're really trying to figure out and focus on is what injuries are we not seeing. That's the worry, is that not the injuries you know about, but the injuries you don't know about.
In Trauma 2, motorbike rider Alan might have internal injuries after colliding with a car.
Not sore in your knee at all?
No.
Can you lift this leg up off the bed? Yep, great. Pull my hand towards you. Push my hand back down. Good. Your wrists feel okay? Yeah.
Fearing multiple injuries, Alan is fully checked with ultrasound and x-rays.
Place room fractures there.
Yeah, that's
Maybe
probably
that's his hematoma across.
Yeah, that's probably what we're seeing.
X-rays reveal Alan has massive injuries.
The chest X-ray in Alan's case shows multiple displaced fractured ribs and what looks like bruising of the lung, which indicates a really significant amount of force that's been transmitted through his chest wall.
He's got some hand abrasions as well. His hands are a bit sore.
But Alan may have even more injuries from being catapulted off his bike.
Is the pain at the back or the front?
Front.
Here?
Yeah.
Yeah. The clavicle might be done here as well.
Broke my collarbone.
Possibly. We'll have a look at the CT. You've broken something along here.
A broken clavicle or collarbone is incredibly painful. Even so, the team needs to check his back for spinal injuries.
We're going to give you some pain relief. We need to roll you and have a look down your back, okay? And then we'll take you around for a CT scan.
The real important thing is that try not to help us or move, okay? You're not going to fall. We'll do all the moving for you. If we hold the elbow and just do the hands, come on.
Hold it with your right hand.
Sorry, mate. I'm really sorry. The shoulder's going to be a bit sore here, okay?
On three. 1, 2, 3.
You're okay.
Are you sore when I push here?
No.
Yeah?
Yes. Yeah.
Yeah?
Yes.
Yeah?
Yeah.
Yeah?
Yes.
Yeah?
Yes.
Yeah?
Move it.
Good to go back?
Yeah.
On 3. 1, 2, 3. Nice and relaxed, mate. Doing well.
Hold on.
Just relax. Head down.
All right.
Dr. Luke's worried Alan's back tenderness is a sign he's suffered major damage.
Has he broken some of his spine and has he sustained a spinal cord injury, which could lead to paralysis?
I'm going to go because the doctor wants to talk to me. But
Across the corridor, former war cameraman John is waiting for the results of his CT scans.
So your daughter was with you in the accident, isn't it?
yeah, I was just looking at that.
Is she fine?
Yeah, she's okay. But she's the one who told me the whole story, basically. Yeah, I'm so glad she wasn't hurt. I would have felt terrible.
John had a seizure at the wheel, and he tells Dr. Ali he's had other seizures.
I was in hospital in Hobart in 2011 for meningitis.
Okay.
Which is what I got in Afghanistan.
Okay. What were you doing in Afghanistan?
Yeah, I was Australia's official war cinematographer.
Oh my God. That must be really exciting and scary at the same time, isn't it?
In Afghanistan, I was in a helicopter.
Okay.
And I sat under the engine without hearing protection.
Okay.
Because I was filming. So I burst my eardrum.
Oh.
And then that got infected, and I picked up the meningitis in Afghanistan.
Okay, so that was...
Yeah, that's why I'm fully deaf and that.
Okay.
Yeah. And ever since then, I've had, I've probably had about 6 seizures like this.
There's a chance that he has another seizure in similar situation. So we need to make sure that the seizure is under control before we can let him drive again.
Dr. Ali and the trauma surgeons take a closer look at John's CT images. They discover the fracture in his vertebrae isn't putting pressure on the actual spinal cord, as they first feared.
John's fracture is at the second lumbar spine bone, which is a little bit above the pelvis top and just below the level that the spinal cord is finished. If his fracture was only a few centimeters above that, he could have become a paraplegic.
I think you've been lucky. Obviously, there's a fracture. You're going to need a surgery for that, but it could be much worse. Hopefully, when you have your surgery, we expect a full recovery after that. Okay, all the best.
It's better news than the war veteran was expecting.
I should be able to make a recovery, so yeah. I hope there's no complications or anything.
I was going to put some socks on your feet.
I'm glad they brought me in.
On an extra busy shift, paramedics are arriving with yet another patient, a 79-year-old woman hit by a car.
What's the trauma?
Pedestrian versus car, 30 kilometres
Yeah.
in a
Oh.
deformed left leg.
Yeah.
Senior emergency Dr. Emma West is taking care of Francis, who was hit on a pedestrian crossing.
Hello, my name's Emma. How are you? Is it Fran? Fran. What I love about my job is connecting with people. Nice to meet you, Fran. Often I see people on the worst day of their life, and so if I'm there to make it a little bit better, then, you know, that's very satisfying.
Ready, set, go. So this is Fran, 79-year-old female, living at home, fully independent. A friend was out and across the road, and she was struck initially on her right side by a small sedan.
Helping Dr. Emma is nurse Emma Hatcher.
My name's Emma. I am one of the nurses. There's lots of Emmas on today. You've got a good chance if you just yell out M, you'll get someone.
I like to keep things really lighthearted for my patients because there's so much going on and there's people coming at them with needles, ultrasound probes. It makes it all seem a little bit less scary.
How are you?
I'm good.
Remember what happened?
Yeah.
Did you hit your head?
No, I don't think so.
You black out at all?
No.
No. Well, where are you sore?
This left leg,
Yeah.
sleep.
Yeah. I think you've broken your leg there. I'm going to get an X-ray soon. You probably know that you've broken it because it's probably really sore.
The 79-year-old grandmother's left leg is badly swollen and deformed from the impact.
And do you know how you got hit by a car?
Yeah, I thought the car had stopped to let me go.
Yeah, okay, yeah, okay. Sorry it happened. Who do you live with at home?
I've got one son living with me.
Yep.
And my daughter and granddaughter live at the house at the back.
Oh, how lovely. I'm really worried about Fran. In your late 70s, you have problems with bones being brittle. Often patients are on a whole lot of medications, so being hit by a car is a significant injury.
With that in mind, one of the first things Dr. Emma wants to rule out is any internal damage.
Fran, I'm just going to do a little ultrasound in your tummy. Right and left upper quadrants are fine. Nearly done, Fran, and we can talk to you a bit more in a minute.
With no signs of internal injuries, Dr. Emma takes a closer look at Fran's leg.
Why is there blood there? Now, she's actually got an open fracture. There's actually bleeding there. So Fran's leg is not only bruised and swollen, there's also a large open wound there. It's bleeding. That puts her leg at risk of a severe infection. It's called an open fracture, and it really ups the stakes in terms of severity of what's wrong with Fran's leg.
We're going to get some antibiotics started, okay? Just because you got a little bit of a wound on the top, we just want to make sure no bugs get in there and grow, okay?
Can you wriggle your toes for me?
Fran's leg is almost doubled in size and she's losing sensation. Both huge warning signs for Dr. Emma.
When there's a broken bone, particularly in the lower leg, there's a risk of pressure build-up. This is because of bleeding and bruising from the tissues around the bone. If there's pressure, that can stop blood supply from the arteries from the heart going to the leg, and if that happens, the leg's at risk of dying.
At the Royal Melbourne Hospital, 33-year-old Alan has serious multiple injuries after a bike accident. They've also discovered an air leak around a punctured lung.
1, 2, 3, slide.
So we're doing a CT to see the extent of the air leak and the collapsed lung, and I need to exclude any spinal fractures or potential spinal cord injuries.
1, 2, 3. Good man.
The young scaffolder's level of fitness may have saved his life. His body subjected to incredible forces when he was thrown over his bike.
Okay, Alan? Yeah. I'm going to have a look at your scans, but you've broken a few ribs. And also, it looks like you might have new collarbones at least. But I'll have a look and just get some a better idea now we've got the computer there, okay? All right, I'll be back. Open up. Good man.
Dr. Luke and Dr. Michael take a good look at Alan's CT images, and the injuries keep piling up.
Right clavicle, left cervical neck humerus. It's hard to tell, but it looked like it on the shoot. Yeah, it's probably in there, yeah.
So Alan has really quite a lot of injuries to the right side of his body. He's got a number of fractured ribs. He's got a collapsed lung. He's got blood around the lung. He has multiple spinal fractures, although the spinal cord appears to be intact. And he's also broken his collarbone.
Dr. Luke breaks the news to Alan.
Hey, so Alan, mate, you've done a pretty good job of it. You've broken a lot of ribs on the right side, and you've got some fractures through the spine as well.
Oh, wow.
But it looks like it's the side of the spine away from the spinal cord, and you don't have any signs of any spinal cord or neurological injury, okay? Which is really good.
Considering the type of accident and the amount of injury that Alan has, he's really, really lucky that he doesn't have any life-threatening injuries.
It's going to be really sore, so we're going to see if the ICU guys will take you upstairs just to make sure that we can keep a close eye on you.
Alan won't be going home anytime soon. He's being admitted to hospital so doctors can help him manage his enormous level of pain. Then it's just a matter of time for his bones to heal naturally. Across the corridor, 79-year-old Frances is remarkably calm after being hit by a car while out walking.
What's your pain out of 10 at the moment?
It's not too bad.
Frances has a badly fractured leg.
Not too bad. What's not too bad out of 10?
Probably only 4 or 5.
Oh, 4? Awesome.
It's hard to tell how much pain Fran is in because she is very, very tough, and you really have to encourage her to see that she's in pain. You don't need to be tough right now.
You're all right.
That's all right.
We'll get you something soon. Yeah. You're okay.
But there may be more going on with her leg because her pain is going up and up despite strong medication.
There's really a good chance that she's got a pressure injury as well going on within her leg.
The pressure injury is called compartment syndrome.
All right, everyone ready? Back on 3.
Just
1,
push the
2,
pillow.
3.
If the compartment becomes too tight, it cuts off all blood supply and it cuts off the nerves, and that risks Fran losing her leg.
Once we've got the x-ray of your leg, we're going to put you in a plaster. The plaster will help with the pain, okay? And we're going to give you more pain relief as well. What does the x-ray show? Oh. So a fractured fibular head, fractured through the knee really as well, isn't it? As well as, which is what they thought. They thought there were 2 fractures. There's a lot of broken bones within the knee. So there's a broken bone around the knee itself as well as a broken bone in the
top part of the lower leg. Fran, I'm going to get a group of people to hold your leg, okay? And we're going to give you more pain relief. And then I'm popping a splint on, and that will help things feel better, okay?
Dr. Emma prepares the plaster splint, but she only has minutes to apply it before it dries and becomes unusable.
Alrighty, I'm almost ready. When I apply a splint to a patient, I'm often thinking about what you do at home. When someone hurts their hand or hurts their arm, you put your hand on it and keep it still and warm. It's really a way of keeping everything nice and still to provide her the best type of pain relief that she can have. How are you going, Fran?
You're doing really, really well. Are you okay, Fran?
Now she's just getting a bend there. Yeah, perfect. Fran, that's done now, darling.
With Fran's leg now safely supported by the splint, she's off to CT.
Is everybody ready? Rolling on 3. 1, 2, 3. Down, 2, 3.
The scans will give Dr. Emma a more detailed picture of the broken bones in Fran's leg and if there's good blood flow.
We're just in the room next door watching, okay? So we're not far away. Now, being that you're laying down, if you start to feel really sick, like you're gonna vomit, I want you to just put your hand up and just call out, okay? Because we'll come straight in.
When they're in a CT scanner, they're in the room by themselves. We are only behind a glass door, but the patient doesn't know that. You could have disappeared off anywhere for all they know unless you tell them. So it is important to let her know that I am just there.
1, 2, 3.
The scans confirm Dr. Emma's fears about compartment syndrome.
The CT scan shows a small artery that there's a lack of flow in it. So it confirms what I'm seeing at the end of the bed. It shows that that artery isn't flowing normally, and it's another marker and another suggestion that she's got a compartment syndrome.
It's now a race to save the grandmother's leg. She's kept under close observation while surgeons prepare to relieve the pressure building in her broken leg.
Do you want another blanket?
Yeah, I'm a bit cold now.
Bit cold? How about you?
Everything has to go perfectly for her leg. She needs to be up and active. We need to do everything to get Fran back on her feet and back to her normal life of being out and mobile and walking.
So your daughter was with you in the accident, isn't it?
Yeah, I was just looking at that.
Is she fine?
Yeah, she's okay.
Former war cameraman John had a seizure while driving and crashed his car. Dr. Ali feared he would never walk again.
We need to make sure that you remain still like this.
A closer look showed the fracture just missed his spinal cord, with John avoiding paralysis.
I think you've been lucky. Obviously, there's a fracture. You're going to need a surgery for that, but it could be much worse.
Back home, John knows how lucky he is.
I think if it wasn't for the quick action of the staff of the emergency department, I would have either been dead or I wouldn't be able to walk now.
You were jammed pretty tight underneath the wheel.
Right.
That's where you were sitting. They pulled you out of that front door.
Both John and his daughter Lilia are trying to put the accident behind them and get on with life.
But I'll see you tomorrow morning.
All right.
I'll be back.
I'll be here. Yeah.
Okay, bye. I love you.
Love you, John.
John is expecting to make a full recovery.
Like, I've had injuries before, and you just have to push through and, you know, the old one foot in front of the other and, you know, carry on.
Ready, set, go.
At the Royal Melbourne Emergency Department, 79-year-old Fran has been a tower of strength in the face of enormous pain after being hit by a car on a pedestrian crossing.
You're all right. Oh, we'll get you something soon.
The grandmother broke her lower leg and several bones in her knee. Dr. Emma was worried she could lose her leg because of compartment syndrome, which stops blood supply in the limb.
There's actually bleeding there.
Fran was rushed to surgery. The pressure was released successfully, but she needed 3 major operations to stabilise her shattered leg. It's been tough gaining her mobility again, but Fran's a fighter.
I can't bend my knee back as far as I should, and it's still very stiff and swollen around the ankle.
Fran's hoping she'll get back to living the healthy, independent life she cherishes.
I'm just expecting to get back to nearly normal if I can.
1, 3. 1, 2, 3.
33-year-old Alan crashed his motorbike while swerving to avoid a car.
And you're on a motorbike, is that right?
So the car cut me off.
The massive force of the accident left Alan with multiple injuries, including 10 broken ribs, a punctured lung, and a broken collarbone.
The pain that I experienced during the accident or after the accident is nothing that I've ever felt. Like having to cough or laugh, sneeze, anything like that. Basic movements were really painful.
Alan's life is finally getting back on track, but the accident hasn't dampened his love of bikes.
Looking forward to the future. I'm definitely looking forward to being able to go back to work. I'm not afraid of being back on the bike. And yeah, plan to get back on the road as soon as I can.
Horse lover Michelle had her fingers dragged through a metal buckle when her horse resisted her. The tip of her ring finger was left hanging by a thread, and it looked like she would have to have it removed.
You're doing so well.
Even though Michelle was terrified, Dr. Emma and Dr. Sarah managed to wash the wound before she went to theatre for an operation.
He's a good boy.
Remarkably, the plastics team was able to save Michelle's finger, reattaching the tip and getting her back to doing what she loves best, being with her horses.
My finger feels a little bit numb, but almost back to normal. Head down. The accident didn't change my attitude towards horses. It's never their fault. It could have been a lot worse. What's the tip of a finger when I made a mistake?